Bismillahirrahmanirrahim. Respected dignitaries, scholars, and dear participants, Assalamu alaikum wa rahmatullahi wa barakatuh, and a very good afternoon to everyone. I am Dr. Ishrat Rasool from Department of Mahiyatul Amraze. I have the honor of being your anchor for this afternoon session. I am delighted to guide you through this segment and of the National Conference on Interdisciplinary Approach to Amraze Dimagh wa A'sab, which is a part of pre-Unani Day celebration. After a thought-provoking morning session and refreshing lunch, it is time to delve deeper into today's theme with three esteemed speakers who will share their valuable insights on managing neurological disorders through Ayurvedic, Unani, and homeopathic systems of medicine. In a world where neurological disorders challenge the very essence of human life, let us turn to the wisdom of ancients. Ayurveda, the time-tested science of life, offers a treasure trove of solutions that harmonize the body, mind, and spirit. Today, we delve into how this ancient system of medicine addresses modern neurological challenges with profound insights. So, to begin this session, it's my pleasure to introduce our first distinguished speaker, Professor Dr. Abdul Khader, a luminary in the field of Ayurvedic medicine. Dr. Abdul Khader will enlighten us on the topic clinical approach through Panchakarma in neurological disorders, bird view. This talk will highlight the contributions of Ayurvedic medicine in the management of neurological disorders. Before his talk, I shall share a brief introduction about him. Dr. Abdul Khader serves as the PhD and PG recognized guide from RGUHS for Kaya Chikitsa in Sri K. Swami Ayurvedic Medical College, Hospital and Research Center, Bangalore since 2016. He has a diverse work experience. He is professor at Sri K. Swami Ayurvedic Medical College, Hospital and Ayurvedic Center, Bangalore. He is a member of Silver Jubilee Committee of Ayush Rajiv Gandhi University of Health Science, Bangalore, Karnataka. He had an instrumental role in the celebration of National Ayurveda Day for 3 years in RGUHS. He is a former academic council member of Rajiv Gandhi University of Health Sciences, Bangalore, Karnataka since March 2019 till date. So please join me in welcoming Dr. Abdul Khader with a huge round of applause. Welcome, sir. Yeah.
राइट कर लेना.
Good afternoon, everybody. Where it is, man?
Good afternoon. Are you okay? Doctor has given a brief introduction. I think she's elaborated a lot of things. Respected faculty of the Unani College and National Institute of Unani. It is very difficult to talk before you because already people have all the half of the people are left out and other people are ready to sleep. But few people are interested that because they are organizers. In the meanwhile, why these particular scientific sessions will go on? Why all the stuff will go on in one another way? All people are in confusion. I'm thankful to the organizing secretary, Dr. Shia, and the in-charge director Nasir Bhai and all other faculty members who is invited me to share some things what I know, lot of things what you know to learn more. What the topic is given to me is clinical approach through Panchakarma neurological disorders. Bird view, I think, because all are awake. Hope so. Yes or no? All are MD and PhD scholars. UG. Then okay. I think my UG students also there here. What will happen, students? It is much difficult that taking afternoon class. Yet to after biryani, much more difficult. Yes or no? Because all UG students are there, all the other faculties are there. It is my duty that I should deliberate for half an hour. Right? I will try to make you awake if possible. Right? Otherwise, you'll sleep also well and good, no problem. The topic is clinical approach to Panchakarma, what we are calling as for neurological disorders. All the people will think that what is Panchakarma, Panchakarma, Panchakarma? Any idea regarding Ayurveda? Because the Unani people in the Unani college, the Ayurveda person is speaking is a lot much more competent enough. Because some people will tell that Panchakarma is already told in Unani college or Unani syllabus. Yes or no? Yes or no? Then why it is called as Panchakarma? Okay, I think rather than this is a seminar or this conference or regarding to my talk, it's only a discussion between you and me because I make you to awake again. You're supposed to make me to awake. That's all, nothing more than that. But Panchakarma, what the people will think that, I think I have lot much more connect to this National Institute of Unani from inception. I came here as a observer for many years, and I'm very close to when the PhD started here. And because I was a PhD committee member in Rajiv Gandhi University, we started the first student from PhD here. That doctor, she got a PhD because I came for examiner for her also for PhD awarding. Okay, last 10 years back also I came for the talk regarding Panchakarma and your Ilaj Takbir or something else. Right? What is there? I'm a small man in front of all of you. I'll share little thoughts. If it's good, well, keep it to you. If it's not good, just forget it. Okay. Then what is mean by this? All the people will think that Panchakarma is massage. Yes or no? Yes or no? No? Yes, good. I think because neurological, from what we understood until now that, where is organizing secretary? Arshia madam is there? She's somewhere. If you take little more minute, you tell me, I will close my session. Don't worry. Okay. Right. We understood that what I remembered in Unani is very famous medicine for headache. What was that? Little more. I think this faculty is supposed to tell. I think what I remember that is Jinda Talisman. Right. That is the first drug. What the people all over the globe are used it, and they got a very good result. Till today, it is there. Most probably in North Karnataka, it is so famous medicine. Understood? If the people will have something on their right headache, they will use this. They will get all right. That is Ayurveda. That is Unani. Yes or no? Okay. Because when we will think of neurological disorder, the first and foremost symptom is headache. All other people are started since morning. They are listening, right? They already started after giving good food. Most probably it is reduced or not. I don't know, but still, right? We have different type of treatments. We'll let you know in the future. But I don't want to go in a deep that wherever nerves are there, you should apply some sort of medicine or give stimulation or reduce the pain. That is called as Ayurveda, what we call as Panchaka. What is this? What exactly we can do in neurological disorders? I think all the people, we are much more competent enough that in such a way that modern people are there, Ayurveda people are there, Unani people are there, physiotherapy people are there, right? Neurosurgery people are there, right? Then Siddha people are there, and aroma treatment people are there. Different peoples are there, no? Right? What we are doing? Are we are curing any disease? The people will come with a right hand like folded and like just stepping out like this. Yes or no? What we will do? We are going to reduce this. We are making normal to him. I don't think. Or we are just correcting his walking style. Maybe little. Right. What we are doing? I think just is balancing to maintain his health until his last breath. Yes or no? It is a much difficult task. Because Arshia madam told me that, sir, you have an afternoon session, first hour before going lunch. I was very happy because the audience was full. Because we are all people are mad, no? When students are full, we will talk something because we are teachers. If they listen, they won't listen. It doesn't make sense. We need full, right? I thought that it was good, but when the meanwhile she came and told that, sir, we'll go for a food. I told, okay, everybody will sleep. Why supposed to do? Why I am making little louder that I supposed to make a balance that you should be awake. That is a key of life, which is very much necessary, right? In that, What we supposed to do? Are we are supposed to remove our brain? We supposed to do something? No. Then what we supposed to do? Are neurological deficits? What they happened? Is it possible to regenerate the things? We think as demyelinating disease, right? Parkinson's is a demyelinating disease. Yes or no? Right? We are coming back to normal. DBS is a very famous treatment modality. I think all over the globe the things are going on, but still they didn't conquer anything. Yes or no? Once epilepsy patient got so much of electrical discharge, we can reduce it or we can control it. Two different things. When patient has infraction, patient has hemorrhage, right? Or we are going to change it? No, right? We can balance it, a normal life as well as in a disease condition. That's all, no? That's what these people thought, that you're supposed to come and start thinking. I came here for the same. Then what is cell? Because everything will start with the cell itself. Life will start with the cell. Yes or no? We call something else, you call something else, but the reality is cell only. From amoeba to human being. Is it so? Sorry. What? If cell is normal, then everybody is normal. Right? Cell is abnormal, then also many people are normal. When they will consult a doctor, they are become abnormal. Is it so? This is one sector. Third sector is cell abnormality, then it produces some symptoms. We people supposed to go and knock the door. They will come to medical college, they will come to clinic, they will go to somewhere else. Is it so? What it is, it starts from that particular cell which is converting as a disease in the same body, but it has some impairment. What we supposed to do? Students and faculty, I'm telling you that we feel happy that we can't cure any disease. Keep remember that. We can't cure. We can console or we can comfort. Okay, only we can give two things. You always keep remember that consoling is also giving a better results. My students will come. I have a headache, so and so. I am unable to attend the class. I told nothing. Go and sit. After this class, you'll get all right. Okay, console me. Okay. Make them comfort, because I'm making you a little more comfort, and some people are discomfort. Sir, भूख लग रही है, खाना खा लिए, नींद आ रही है. At least little sound make you to awake. Yes or no? That's what we are dealing it. Balance to imbalance or imbalance to balance. Then what is life? Why this neurological disorder has so much of impact on the body? What was the reason behind that? In a life, one, the crippling thing start in a life when the patient is sick with paralysis. Patient is sick with paralysis. Patient have demyelinating disease, motor neuron disorders. Patient have injury at the brain. I'm telling you that we should thankful to Almighty. I saw that beautiful thing that God has blessed so beautiful thing as a human being to us. I'm telling you that we are blessed. In a 1 second, from this particular point to that particular point, from top to end, if one neuron get depleted, one neuron get depleted, I think all the people will get very difficult to live in their life. For example, right, when we get a hit on a head or get injury at a head, where are you? So the first people will ask, right, where are you? Oh man, we don't know, right? The people will get confused. Mother, wife, children, right? That particular called as memory. Memory has a lot of impact on us. Yes or no? When we will see that, because this is the first time I'm coming to this auditorium, because I'm quite common to your other auditorium. I went there. Right, I came back because I had a memory that last 10 or 15 years back, I came to your college and given a guest lecture. That event is very important. It is cycles are lot of events in our life. We will capture our memory. Yes or no? That if you will forget, then the neurological disorder has big impact. Second thing is verbal pronunciation. Verbal pronunciation that, Are bhai kaise ho? Okay. If you talk something, then we are also okay. Right? Otherwise, what will happen? That if the patient won't talk, then doctor will get panic. Right? The patient is trying to tell something. Patient is trying to tell something, then the sound or voice didn't come, right? Then also a much more problem, right? I'm telling you, see that in seconds, our students will tell, sir, is something in different in college, here also something in different in this particular platform. That particular connection between neurotransmitters, afferent as well as afferent, will give a clue, right? That will create a sound, right? These are all the things are going where? In a mind. If the things are good enough, अरे भाई क्या जिंदगी थी, क्या खाना था, right? It is colorful, right? For that, we are all trying in different system that how best we console or comfort the patients. Our journey will start here with Panchakarma treatment. Right? What is Ayurveda then? Because we have in our syllabus also, most probably in your syllabus also, one chapter is there, that different system of medicines, what they will teach. Yes or no? I think we teach our students that in a medicine that what Unani will teach, what aromatherapy will teach, what yoga will teach. In similar way, you also have it. Right? What are the idea you have? Anybody? What do you mean by Ayurveda? I'm taking liberty that you are students. Don't feel in other sense, okay? Right? Don't be like offended. Hey, what Dr. Sahib is telling like that. Don't think like that. Right? Anybody has idea? It's an interaction, man. Because afternoon session is always making us sick. Any idea? What do you mean by Ayurveda? Sorry, madam. Madam only telling because she is the organizing secretary. Yeah. Bola, madam. No problem. Yeah. Life science. Very good, sir. Little more. Science of life. No, little more. Yeah. Anybody from audience? No? Sorry, madam, please. 3 doshas. You have 4 doshas. I know that. Okay. Little more. I think I'm telling you, students, don't feel bad. Ayurveda, Unani, and other people are bhai. Yes or no? You will tell in Sanskrit, you will tell in Arabic. That's all. Right? I went to Greece. I went to Europe. The people are teaching us. Right? The people are teaching us in due course after 20 or 30 years. I become a old like the 60 or 70 years. Right? Those people will come and teach our students. It's very unfortunate. You are blessed that your Indian students, you learn a lot of things. What? This is the Indian system of medicine. Right? What Ayurveda says, you will tell, no, sir, it is Tridosha, that dosha, this dosha. You will see that lot of myths are there in Ayurveda, similarly with Unani too. What exactly it is? I told same thing in America too. Right? Ayurveda is, all the people will come and, I think my house surgeons as well as my PG students are there. They will tell that, sir, namage massage beku. Is it so? Right? और दादी माँ कुछ गोली दवा दे रही थी जिंदा तिलिस्मा. That is Ayurveda. That is Ayurveda. Right? No. I think lot of myths are there. The people will think that it doesn't have any appa, amma. The people will give something and get reduced because, right, we are recently celebrated Ayurveda. You are celebrating Unani Day. Narendra Modi told that Prakriti, because we need evidence. We are just giving good results. The Honorable Prime Minister, because Prakriti, this one is going on. We may get a Guinness record also in few days. I'm telling you that it is quite common phenomena that the people are think that it is only preventive measure. Or it is like our Dadima is giving that adrak as well as lasun, this is Ayurveda. Or other thing, the people will think that it doesn't have side effect. And some people will joke me in my other contemporary colleagues that no action, no reaction. If it was so, the people will think that how can it sustain for 5,000 years? How can sustain? I'm telling you. How many times you make fool the people? Or it may be 100 years, 200 years. I'm telling you, student, it is a life science with all the etiopathogenesis along with prognosis, along with the treatment aspects. In that, one among is Panchakarma. I think since morning, Dr. Bhimra also spoken, because Arshya Madam also speaking, how to differentiate in neurological disorders in understanding. Understanding in such a way that some anatomical structures are damaged. According to that, we are supposed to understand. Because sir phuta hai, haddi tuti hai, it maybe has some sort of injury. Or it may be because of the blood vasodilatation is not happening. That is pathophysiology. Right. Or lot of signs and symptoms. मुझे आंख नहीं दिख रहा है. Lot of things will come under that. Or symptoms. Patient is कुछ दीवाने तरह बात कर रहा है. all the things. According to that, we're supposed to bifurcate neurological disorders. What are the symptoms? Quite commonly, the patient will come to you in a OPD that what you need it basically. How to identify? Because first thing is, all people know that no emergency in Unani and Ayurveda. Yes or no? Who told you? It's all myth. Right? People are told, you are listened, you are also writing the same way. I'm telling you that blood-brain barrier. Blood-brain barrier is a media where you're supposed to give a medicine. That is invented by traditional people only, for your kind information. Blood-brain barrier, what the people injections came in recent years. What about the earlier people? I'm telling you that we are blessed as a Ayurveda and Unani doctors. We have a lot of information, but we are not utilizing. We don't have a confidence to tell other people that we are good enough. Right? What are the symptoms? I saw a lot of times when the emergency will come, my students, all the people, hey, call Abdul. Okay, fine. What? Because they are in a confusion. The people who brought the patient are in anxiety. The third thing is, patient will speak sometime, patient won't speak. Right? Fourth thing is, patient can die anytime. These are all the symptoms are quite common in neurological disorders. In the same time, it may be a functional or it may be organic. It's always left to you that according to your experience, you're supposed to describe or define to a attenders. Don't bother students. I'm telling you that don't bother that to handle the patient. Once you will get fail, second time you will get a fail, third time you learn by your own. Right? Because we have a lot of information with us, but we don't know how to implement that. The fourth thing is, patient will come unable to stand, giddiness or vertigo. This particular thing make you a little more uncomfortable. At the same time, patient is always deviated mouth, unable to open the eyes. These are all the quite common symptoms which make you to understand. Then what we can do? हम तो भेजे को हाथ नहीं डाल सकते. Verbally we can, but not really. Right? What we can do? We can do balance for that. What are the diseases quite commonly we will see in our routine practice? I'm telling you, student, that first foremost is paraplegia or paralysis or parshvavayu. आप बोलते हैं फारसी. Sorry, ma. College. I think it's Urdu because the people can't understand. I'm telling in Hindi. Right? Paralysis. I'm telling you, student, that paralysis is a condition where traditional people are treating and they are getting a result. For example, Palomner is an area near Bangalore. You have idea? Right? Yes, sir. Yes, sir. Good. Because who is treating that patient? His daughter is my student. Her name is Ashwini. He is treating, because I met that guy, he is treating that patients since 3 generations. वो आयुर्वेदा एलोपैथी या यूनानी या कुछ. Then you should think that we have upper hand since inception of the mankind. Nimans came recently, last around 50 years or 60 years before that, but the quality of life is improved by treating the patients. Keep remembering. The second thing is, when the morning patient will wake up, he will think that deviation of mouth. When you'll go and drink a water, it will fell down. He will think that, hey, वहाँ कुछ जड़ी बूटी दे जाके लेके आओ. Yes or no? Third thing is, when the patient will have fits, or patient have a tremors, all these things will quite commonly will come. Other than that, patient is unable to speak. You see that? If I think all are nowadays, I feel very happy, man. Around 40% males are there. Quite commonly 70 is female, 10% is male. Okay. Why I am telling that? You see that when the child is unable to speak in a young age, because I have 2 children, right? What your dadima or other people will do? They will do some take across calamus. They will make the people to tell to apply to a tongue. Yes or no? From inception it is working. Why people are afraid to give that? You should think twice, no? Yes or no? I'm telling you that these are all the symptoms in a different names they are given. What treatments we have in our Ayurveda? Some are oral medications, some are treatment procedures, some are rejuvenatives, and this Panchakarma, what you call as conference on that particular point, biopurification treatment. What are those? I think what you have, we are also in the same way, right? In that, I think I'm telling you because I came to this particular platform, I'm supposed to use this slide. This is supposed to be a special treatment where you treat with procedures also. It may be a bath, right? Or it may be a cupping. I think cupping has taken a very great version. And all the people are much more behind that. Exactly right. It is giving good results and people are practicing. And at the same time, it has scientific validation too. Three things are very important. The patient or people supposed to accept us and give a result. In the same time, we are able to make them convince others. I don't know how much I'm convincing, but still I'm trying. All these things are right. What is that? We have different protocols. All the people thought that initially that only operation has pre-operative, operative, and post-operative. Any procedure, any treatment, any system has that. But they made SOP, you didn't make. That's why we are here. Right? In that, different treatments has pre-operative, operative, as well as post-operative. In that, different things are there. I think all the people are much more aware of this particular slide. Is it so? What exactly it is? The people are telling that the people, when they will see that Kerala people has kept one particular dhara, hey, this is Ayurveda. Because you should appreciate those people. Those people who made so much big impression all over the globe that, right, Ayurveda is Kerala. Sorry, Ayurveda is in Karnataka too. Right? What they are doing? Only external treatment. Only external treatment. They are not going for internal treatment. And they are getting good results too. Here, lot of things are there. I will go explain one by one. I think if you will give a ghee, I think it will reduce half of the diseases in neurological disorders. Are you aware or not? If you will give a oil, definitely yes. I think other what you are telling charbi, that this, I think these are definitely giving a good result. But we don't know how to explain it. The people who is suffering with paralysis or the Bell's palsy, I saw that traditional practitioners in India, they are giving 200 to 300 ml ghee in one instant, the patient will get all right. It is also true. It is also given results, right? Internal medication as well as external. All the people, what I remember that if you'll get a Bell's palsy, I don't know you people are using or not, they will take a meat, they'll chop it better way, right? They will take and just rub it. It is also giving a results, right? Where it is a treatment procedure. How it is utilizing is always left to you, right? What internal administrations? I will go when I'll get the cases. I'll tell one by one, because at that time it is easy to remember. External treatments, what we call as a pigital and other things, and different steam. Different steam will give that. It may be a local, or it may be whole body, or it may be half part. It may be due to water, or it may be steam, or it may be air, or it may be a little combination of all the things what we'll use. I think this is very important treatment what the people, Kerala people are made that Marma Chikitsa or Kerala treatment, because in that also the patients are getting very good results. I think these are the 5 treatments what we have in our department. I think you have the same thing. What we'll do patients for emesis, right? For purgation quite commonly, right? Next is enema treatments and nasal treatment and bloodletting what you are doing in a cupping. What exactly the Panchakarma will do? What exactly the Panchakarma will do? Right? How it is beneficial? I think I just tell you for your convenience. It is a detoxification or biopurification treatment. What it does? Definitely yes, it will break the real pathology, and it has for long run. I saw that many people will do makeup for a marriage, right? It will go for 1 month, no? Similar way, right? And less chance of reoccurrence. The chances are the re-attack will be less in that. Okay. More than that, it nourishes the whole body in such a way that I'm telling you, if you clean your bathroom, the similar way we are cleaning your whole body in different methods. I think because they told me as a clinical approach, they are given a time also because already getting late. We have some patients. What? Because I don't want to tell lot of things. because my student told that you should give some idea regarding, sir, Nasya sir, I will give little later. Some patients which attended my OPD and I made them admitted. These are all things are there. Deviation of mouth because the Bell's palsy patient, and difficult to close his right eye, like what you say, see Ramdev Baba, no, ptosis, similar way, right? And pain in occipital region and incomplete evacuation of the bowel, right? So what MRI will tell? I think they told that it is old lacunar change. It was a old, but the patient come up with the inflammation of facial nerve. What we are given that, right? We are diagnosed as, in our terminology, you tell in Urdu or Arabic, we will tell in Sanskrit, that is called as Ardita, right? This patient treated with initiation of one particular medicine, right? It is a combination of different medicine with castor oil. Castor oil, you also treat, I don't know that, but right, initially for a first day because the patient is constipated. Right. After that, we are given a whole body massage. Right. I will use as a massage because we are used as a Abhyanga. Right. Along with that, a powder massage in some of the areas and facial massage. And along with that, we quite commonly use a particular medicine. I told you that do a tongue. You're supposed to use as a just clean your tongue. That way, we'll use a medicine. Along with that, we'll combination of your saindav namak and bach, vacha. तुम्हें क्या बोलते हो उसको? Vach, vach. Alright. And lemon juice. It is giving very good results. And we told that because the patient need some consolement, if you'll do that, you don't feel happy, you will send for that physiotherapy also. Before treatment and after treatment. Age is 58 years. The people will think that it is the only patient got relieved. Other patients, no. I am telling you that lot of patients will get relieved. A time is very important. You should understand in a right way. You should understand in a right way and diagnose in a right way. It is due to infection, herpes, or any other infection. Right? Facial paralysis, what you think that it is not only due to a cold weather, it may be due to infection also. It may be secondary to the other diseases also. Always we should think that it is not only because of this, it is because of the lacuna or infraction in a brain also. That patient got a very good results. Here, because this patient in 10 days, he got very good results. Second is paralysis. The patient is suffering with hypertension as well as diabetes mellitus. Along with that, patient is not taken proper medication. Accelerated patient came and told, just to go through this, patient is unable to lift his leg as well as hand, is unable to lift, and at the same time is unable to speak normally, since 6 months. Since 6 months, you always keep remember students, the patient will go all different places. First modern nursing home he will go, you won't get result, you will refer to another center, they won't get result if they are good center, okay, they will give some medications and admit the patient and treat the patient, then they will send it, अब ऐसा ही रहता है तुम जाओ. It is only that you can do. After that, the last option is Unani or Ayurveda, the people will come to us. Keep remember. Right. The treatment is given similar way. I am telling you that these are all the things we are given oral medications also. But here, one thing is there. This particular patient, I should feel happy that this patient is my friend, my junior's brother. His name is Mahesh. This patient got admitted in Gulbarga, and all the people are told that they don't have any chances, but they know us what we can do in Ayurveda. We will try it out. The patient brought from Gulbarga to Bangalore to my college, and I saw the patient in video call. I told that it is much difficult. You're supposed to ready for do or die. Trusted me, and God has blessed get relief. I'm telling you that he was totally unconscious. He was totally unconscious. This is another patient where we supposed to go back, man. Somebody can help me? Madam, another 10 minutes. Huh? No, because you are giving me a time, no? Yeah, next school. Go back, go back, go back. Back, back. Go back. I'm telling you that this patient brought in that way. They trusted us and he got all right because this
Shall I play?
yeah.
टच मत करना ऐसे कोई टच करना उठिए हाँ बस उठिए फिर से उठिए टच मत करना कुछ सीधे बोलिए स्ट्रेट अच्छे से करके ऐसे हाथ करिए स्पीड हट सकते
Just go, just see that
स्पीड से
this patient has a carotid stenosis.
21
All people are told that it won't get all right. It won't get all right because it is like this one only. Right. The patient was admitted for 3 months in our hospital and got very good results. He is able to recognize, he is able to understand, he is able to go and do his own work and is ready to speak also. Right. It will take time because those people will feel bad for me. Right. The other thing is, all the people thought that it is much more difficult. We are given one particular enema treatment which made this patient to get all right because all modern medicines, Ayurveda, physiotherapy and counseling also beneficial for this patient. And at the same time, how you are making the confidence supposed to be improved. That is also given a good result. Another patient recently, last one, I think last year, the same time, right? The patient brought here with one of my student, right? They told that if this patient is also carotid artery stenosis, the patient has all the different symptoms what we have spoken. That particular patient here in Bangalore, here only nearby, he is running one cloth is a industry, he has a cloth industry, right? Ready-made industry. He has more than 200 employees with him, right? He is the patient. What are the medicines you are given? Okay. How to make it, man? Right. Now, yesterday he called that. Right. I told him that he was like this. All the people are told in the Prakriya hospital that the patient is going to die. He needs surgery.
ಪ್ರೈವೇಟ್ ಹಾಸ್ಪಿಟಲ್ ಜಾಯಿನ್ ಆಗಿ
Sound ಬಿಡೋದು.
ಚಿಕಿತ್ಸೆ ತಗೊಂಡಿದ್ದಾರೆ ಶ್ರೀ ಕಾಲಭೈರವೇಶ್ವರ ಆಯುರ್ವೇದಿಕ್ ಮೆಡಿಕಲ್ ಕಾಲೇಜು ವಿಜಯನಗರ ಪೈಪ್ಲೈನ್ ಇಲ್ಲಿರುವ ಆಯುರ್ವೇದಿಕ್ ಕಾಲೇಜಲ್ಲಿ ನಮ್ಮ ಮಾವನಮಗನಾದ ವಿನಯ್ ಕುಮಾರ್ ಅನ್ನೋರು ಓದುತ್ತಿದ್ದಾರೆ. ಅವರಿಗೆ ವಿಷಯ ಮುಟ್ಟಿದಾಗ ಅವರು ಬಂದು ನಮ್ಮನ್ನು ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡಿ ಮತ್ತೆ ಅಲ್ಲಿಂದ ಮತ್ತೆ ವಾಪಸ್ ಹೋಗಿ ಅದೇ ಹಾಸ್ಪಿಟ್ಲಿಂದ ಮಾನಸ ಬಂದು ಚೆಕಪ್ ಮಾಡಿಸಿ ಬಂದು ಚೆಕಪ್ ಮಾಡಿಸಿ ಆಮೇಲೆ ಎಲ್ಲ ಚೆಕ್ ಮಾಡಾದ್ಮೇಲೆ ತಿರ್ಗಿ ಆಮೇಲೆ ಡಿಸ್ಚಾರ್ಜ್ ಮಾಡಿಕೊಂಡು ಅದೇ ಶ್ರೀ ಆಯುರ್ವೇದಿಕ್ ಕಾಲೇಜ್ ಆಯುರ್ವೇದಿಕ್ ಶ್ರೀ ಕಾಲಭೈರವೇಶ್ವರ ಆಯುರ್ವೇದಿಕ್ ಕಾಲೇಜಿನಲ್ಲಿ ಆಯುರ್ವೇದಿಕ್ ಮೆಡಿಕಲ್ ಹಾಸ್ಪಿಟಲ್ನಲ್ಲಿ ಬಂದು ಅಡ್ಮಿಟ್ ಆಗಿ ಸುಮಾರು 12 ದಿನ ಚಿಕಿತ್ಸೆ ಪಡೆದು ನಂತರ ಗುಣಮುಖನಾಗಿ ನಾವು ಮತ್ತೆ ಡಿಸ್ಚಾರ್ಜ್ ಮಾಡಿಕೊಂಡು ಮನೆಗೆ ಬಂದು ಈಗ ಆರಾಮಾಗಿದ್ದೀನಿ. ಈಗ ಚೆನ್ನಾಗಿ ಇದು ಅರ್ಜುನ್ ಸರ್ ಅನ್ನೋ ಡಾಕ್ಟ್ರು ನಮ್ಮನ್ನು ನೋಡಿದ್ರು. ಅವರು ತುಂಬ ಚೆನ್ನಾಗಿ ತುಂಬ ಚೆನ್ನಾಗಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡಿದ್ರು. ಅವರು ಅರ್ಜುನ್ ಸರ್ ಅವರು ಟ್ರೀಟ್ ಮಾಡೋದ್ರಿಂದ ಬೇಗ ಗುಣಮುಖರಾಗಿ ಆಮೇಲೆ ಫಿಸಿಯೋಥೆರಪಿಯನ್ನು ಮಾಡಿಸಿ ಚೆನ್ನಾಗಿ ಬೇಗ ಒಂದು ಅಂತ
I think I'm telling you, friends, that this is the output of a treatment modality which is given with a different treatments. In that one we called as enema treatment. It has given excellent results. In 12 days of treatment, patient we sent back to a again MRI. The patient got a very good result. We sent for a doctor also, very good result. These are the reports, what is there before and after. At the same time, another patient, I want to tell you that the patient came with us like this. He was a DTP worker in Yeshwanthpur. If you go and meet him also, all right. This particular condition, the all neurologists and other people told that you are not able to get a good result because only is surgery. That diagnosed as radial nerve palsy. Right. He is 58 years, non-hypertensive as well as non-diabetic. I think I presented this paper in international journal. We got very good response too. Why I am telling you that? First is I told you Bell's palsy. Second is paralysis, quite common. Third thing is with stenosis. Fourth thing is radial nerve palsy. Other people will think that demyelinating disease or this doesn't have any treatment. The patient earlier, after that, now still he is working as common as we and you, is still doing DTP job, and it has got so much popularity. We can treat with our treatment. We are treated with nasal treatment and different treatments what we'll use in our daily practice. Let's Griva Basti, the local area treatments, and Dhara. Okay. Other than that, GB syndrome. GB syndrome, the people will tell no treatment, it needs immunity and so on and so forth. It need immunocompromised drugs. If this particular need transfusion and plasmapheresis. We treated, we got very good results with only 3 treatment, Virechana, Nasya as well as Basti. Means enema and nasal treatment as well as a purgation treatment along with oral medications. Why I am telling you that? You should have confidence to explain in a better way. You should have a confidence in a explain in better way because it is a living example. Recently we are treated with the Parkinson's also. I think myasthenia gravis, other things will go little. Parkinson's, I want to tell you that. The patient came from US. The patient is suffering with last 13.5 years. No treatments are beneficial, but still is good. But his wife is Dr. Pretty. She is a Ayurveda Medical College, our Bangalore College student. Right. She was also suffering with Parkinson's. We have treated that patient with purgation treatment, external treatment, Shirodhara. Right. Along with that, we are treated with herbomineral preparations. Patient got very excellent results. The patient is unable to move. The recently last week they went to US. They called me. Now she is much more better than earlier. I think these things are very important to understand. If you'll go through this, what are the things will happen here? What are the things will happen? By doing massage, what you will get? I think all that people will tell. You should be confidently tell that. Right? This serotonin level, how it will beneficial, how it acts on endocrine system, how it acts on a mood, how it acts on neural reflexes. These are all the things keep in your mind. You are a young-blooded children. Tomorrow you will go as a scientific people in a Unani system or Ayurveda system or Indian system of medicine. You should be able to convince others. Amar aisa hi karta hai, vaisa hi karta hai. No, the people need evidence. They should understand. I am telling that this is a research job. Definitely it will increase blood flow. Definitely it increases the blood flow and it also reduces the muscle tension. Along with that, it produces lot of endocrine system technology. Right? Because of that, I am telling you, student, the hormone, we don't know what you mean till today. Till today, we will tell this is a catalyst, so and so forth. In the new, if you will go in a neurotransmitter level, most probably you are unable to give an answer properly because the God blessed beautiful thing with hormones. That is corrected by our line of treatments. Right here, metabolic rate, because all the viscosity, how we supposed to understand that in different parameters. For that, you need a big class. Right? Or scientific validation. I think what will do, it will improve the immunity and so on and so forth. This neurological disorders, that particular gut as well as mind has a great relation between each other. If you correct it by purgation treatment, half of the diseases will get corrected by themselves. Right? That's why this particular treatment is beneficial. Right? I've told you, detoxification, hormonal abnormality, and circulatory problems. Next is, I think, Nasya. Nasal treatment. All the people. Okay, madam. Sorry, 2 minutes. Okay. Okay. Dr. Saab, is it okay with you? No? Okay. Okay, fine. They are telling you're supposed to complete it. Okay. I think emergency, I told you that blood-brain barrier, how it will beneficial. All the people think that Ayurveda and Unani and other people are not using any medicines for emergency. I'm telling you because this particular route directly connected to a brain. Right? Whatever you will keep here, it will go inside. That's what I'm telling you. This particular treatment in an unconscious patient, a simple align sepa, what you use a patch onion. I think that drops also make a difference. Jatamati, right? That particular thing always make a difference to make conscious to a patient. Along with that, a vacha, what you told no vacha, right? It has given excellent result. I will go through, just you will go through this, the people will understand. Some researchers we told, okay, I don't want to spend much of the time. This particular condition, pain management as well as foot drop, we are using this treatment, venesection as well as leech applications are giving very good results, right? When the it will drink, you also feel happy, other people also feel happy, right? This is our hospital where we are working with a lot of people. This is my private hospital. I am working as an employee in Kalabarishwara too. All different people are coming and getting good results. I think one thing I want to tell you that because of short of time, right? I told something. If you need much more, definitely you can reach me anytime. Thank you one and all for your patience listening. Hope that I completed my 40. Hope you
Thank you so
understood and
much,
wake
sir.
up.
You made it really engaging. Thank you again. And thank you for enlightening us with your wisdom. Your in-depth exploration of Ayurvedic medicine has provided a new perspective on role of traditional therapies in modern neurorehabilitation. I would like to invite questions from the audience, sir, please. Anybody having any question? No, sir, you really made it engaging. I guess we have no questions. Now I would like to invite Professor Arish Muhammad Khan Sherwani sir, HOD Department TST, to present memento to Dr. Abdul Qadir sir. Huge round of applause from audience, please. Thank you, sir, for doing the honors. Addiction is modern epidemic that shackles the body, mind, and soul. While it poses challenge for medical science, Unani medicine, with its holistic approach, offers a path of liberation, guiding individuals towards physical healing and spiritual balances. So, our next eminent speaker, Dr. Gulamuddin Sofi sir, will share insights on the subject of drug de-addiction in Unani medicine. Sir is presently professor and HOD in the Department of Ilmul Adviya at NIUM. He has a wide range of publications which include more than 150 papers in national and international index journals. He has also contributed as an author of 2 books. He has a diverse experience. He is responsible for establishing Animal House at NIUM and worked as its in charge for 15 years. Editor for Journal of Research in Unani Medicine, member for Animal Ethics Committee for last For last 17 years, member of Technical and Research Committee for NIUM. Give him a hearty round of applause as he takes the stage.
Respected participants, our resource persons here, good evening to all of you and Assalamu alaikum. Today we had a lot many lectures, lot many talks, very beautiful talks, and we heard from various perspectives about the disease of nervous system. And this one is a bit different one because it will throw light on the higher mental functions. Basically, we talked of neurology, we talked of neural disorders and other things. But here I want to see some behaviors, compulsive behaviors are caused by various substances which we take in our life. Like we have an impulsive behavior towards salt, common salt. Whenever we take something, if salt is not there, we say that bada phika hai. Then we are tempted to add salt. And this salt addiction has been there since antiquity, when it was discovered in China, something 5,000 years before. But here, in the present day, one more addiction which is very much frightening is that of mobile addiction, which our children are getting very much addicted to. So when we talk of de-addiction in Unani medicine, it should include everything, all those substances. But here we will have a model of de-addiction, how we de-addict things, how we de-addict ourselves from various substance abuses. We will exemplify something. So So today what we will see what is drug addiction, its meaning, then Unani perspective of drug addiction, then we will see methods of drug addiction, then opium de-addiction as model for de-addiction. Then we will see what is abstinence syndrome, how it is managed. Then we will see drugs used for de-addiction, then a roadmap for future work. Here we will see basically this addiction if it was defined as defined by DSM-4 or ICD-10-R. We say it is cluster of behavioral, cognitive and physiological phenomenon that develops after repeated substance use and typically includes a strong desire to take the drug. It also includes difficulties in controlling its use and then persisting in its use despite harmful consequences, and there is high priority given to drug use then to other activities and obligations. Then again we have increased tolerance and often a physical withdrawal state. These various criteria criteria are there when we say it is an addiction. It should have repeated substance use, then there should be difficulties in controlling the use, and then we should have harmful consequences, and then high priority is given to drug intake. We may have not many works, we may have not many activities, but a person is compelled to repeat his one habit. Then increased tolerance, we add the doses, we add the substance, and often there is physical withdrawal state. If we don't take it, there are definitely certain reasons, there are certain consequences, what we call withdrawal state. There may be abdominal cramps, there may be headache, there may be anxiety. We call it withdrawal symptoms. So when we are known that what drug addiction is, uh, we may say that the core feature of drug addiction, namely the compulsive use of drug despite physical, psychological, social harm, has aspects of impulse control and compulsive disorders, which may lead to relapse or reinstate of drug-seeking behaviors even after relatively long periods of abstinence. Basically, when somebody has a compelling this habit of drug abuse or drug overuse, sometimes he may shun it for 1 month, 2 months, 3 months. Still, there can be recurrence. He will compulsively follow this habit. We will say that relatively long periods of abstinences does not mean that the person is de-addicted. There should not be that craving. There should not be uh, hangovers. There should not be any withdrawal. Then we say we have de-addicted a person. It is this late relapse that makes the therapeutic management of drug addiction a major challenge. Of challenge, and not only challenge for the person, for current research and drug development also. Today, drug addiction or dependence, both terms are used interchangeably. We interchange them in consensuously defined, at least within the biomedical community, as compulsive drug use as opposed to controlled drug use, such as, for instance, episodic smoking in tobacco chippers, and for other medical and non-medical cases of controlled drug use. So we have to differentiate between controlled drug use and drug abuse. Several behavioral criteria have been defined to distinguish compulsive from controlled drug use. There are various references. I have made it in Howard style. So let us see what is the cause of this drug abuse. Major determinants for initial experience when a person comes in the club of drug abuse or addiction, it depends upon the drug availability. If it is available freely, a person can have high chances of being addicted. And then there is social acceptability. If some behavior or habit or drug use is considered socially acceptability, then there are peer pressures. If a person is in a company, certain group of a company, those all his peers are accepting that a person is of our group only when he takes some substance. Then the person who is included in the group, he is pressurized to go for this initial experience. Then we have mood state of a person. Usually the people who are in depressive mood because of some social problems, there are more chance that he may get addicted. Then there is also a drug experience. Only for that, oh, let me see what happens if I take the drug. Let me see that euphoria. Let me see what it takes to take certain drug. Then this initial experience, he goes for the initial experience. Then there is also a genetic endowment. It may run into the families, and it is well established fact. Then we have another state, that is progression to dependence. It can be a neuroadaptive state if initially experiencing, then again experiencing it, then he will get adapted to this state and this drug abuse starts. Or mood enhancement. Again, I said when there are certain stressors, a person is taking some substance for calming himself or herself. So he goes on to take it, then increases his dose and becomes an abuser. Then there is psychosocial facilitation also and avoidance of withdrawal symptoms. It is a very late stage. When a person has fallen into the drug trap, he may not come out of it because of advanced withdrawal symptoms, because of headache or because of cramps or because of sleeplessness, irritation, anxiety that makes a contingency for him to go for this drug abuse. Then what are the substances which we use as a drug abuse? Basically, in what I have collected from comprehensive textbook of psychiatry by Kaplan and Sadak, it says that it is the alcohol, which is the foremost thing, then amphetamines, then caffeine, cannabis, cocaine, opioids, hallucinogens or psychedelics, phencyclidine, inhalants, nicotine, sedative hypnotics or anxiolytics, or polysubstance uses. Even we have seen that incidences of, to me, some patients may come, they go for this uh, taking pants, uh, just for some fun. They take these pants, and it has become a habit of taking pants. Though there is some heavy metals in it, it may cause harm to their kidneys, but they are addicted to it. And several other ways. Then we have some treatment strategies, how we treat. Generally, I am saying this like early brief interventions. When a person is just going into the drug trap, we may go for early interventions. Say, for example, we outreach to him, counsel him, say him about harm reduction, or we go for the harm reduction, and then low threshold interventions can be done. But afterwards, when he is an established addict, we go for detoxification, and this detoxification includes some pharmacotherapies, isolation, and then we go for counseling and psychotherapies. Then we can have also pharmacotherapy along with it, so that we may substitute for this abuse drug. But it all happens in a particular way, in a particular sequence. Say, for example, we have self-help groups, or we have continuing care or aftercare, and we have the settings where we can do it. It may be a residential treatment. We can take the person in wards, this person in ward, and then we can treat him, or it can be an institutional treatment, or we can have what we say subway home. It is like home conditions, but he is away from the home and he is kept there, and then we go for all these detoxification, counseling, and psychotherapy, and then pharmacotherapy. This change in addictive behavior does not occur abruptly. So 5 stages are proposed. Whenever we take a person in confidence and we say him that let's go for the de-addiction, we have to contemplate for 5 steps. That is pre-contemplation. We have to manage him. We have to tell him what help it will do if you go for this addiction. Then we have contemplation state. It is an active phase where we have a contract what he should do and what he should not do. And then we go for the preparation. What type should I go for counseling, pharmacotherapy? Should I go for isolation, detoxification, or pharmacotherapy? This is the main step where allopathy has gone a bit very much far, and we are yet stuck to certain things. Then we go for maintenance. Here in Unani medicine, what I have primed you what is all about this addiction and de-addiction. But in Unani perspective, what this addiction is, it is similar way we increase the dose, or has the person increase the dose. There is all those 5 criteria ISMR, ICD 11R has stated. But here certain drugs are there which in our books we find it, say opium, cannabis, yabruj, bazarul bunch, And we may add various, I have not added, so I put dash 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 there. And we have nabis and sharab, alcohol. Here, how we go for this de-addiction process in Unani medicine. So there is one principle for it. We call it tadrij wa tawiz. Tadrij means slow, gradual reduction method, and tawiz means substitution of drug. So this is the only principle. Even in modern medicine, we go for substitution. What we say, giving alternate. If we have an open addiction, we go for naloxone challenge, and again we have this tadrij. It is slow, gradual. Even today, we have to this take the patient into isolation for at least 40 days to 6 months. Then it is easier for him to go for this de-addiction. Then we have in Unani medicine, we have interventions for craving also, and again we have certain interventions for hangover after alcohol intake, and then we have a lot of things for control of withdrawal symptoms. Emphasis on behavior modification counseling, surely it has come from uh, last 1400 years from our prophetic medicine about this emphasis. So this is not a new thing. So in Unani we also emphasize this thing, which may include pre-counseling from addiction counseling at the time of addiction to the last maintenance stage of counseling. Then we have, if we see this slow gradual reduction or Unani methods of this de-addiction, basically it is a very long treatment. It may take 6 months to 1 year. And this method is slow gradual reduction. We reduce the substance and add some inert substance and keep on reducing it, managing it in between, balancing him in between, and then at the last time when we free him from that substance, we try to see whether for how much time the addiction has happened. Then we have protracted withdrawal needs to be minimized. That is, we have to control the withdrawal symptoms also. So here, the same thing we say that the stages of gradual withdrawal, it includes by substitution, that is by tawiz. We have three types of it. If we go for tawiz a munasib, that is we have an appropriate substitution. We take a drug and replace the substance use, which has the properties similar to that of substance of use. We say that it is an appropriate substitution. It has also three types, which is munasib tamun nisbat, accurate substitution. Munasib shadidun nisbat, we have another drug which is of more severity than the drug of abuse. And then we have munasib bayidun nisbat, which is very far away. It may be in mizaj or it may be in drug action, but we use it. Then again we have another way we do for tawiz gair munasib. Here we don't have equal opposite the substitute drug. We have opposite of the substitution, or we have nearby opposite substitution, or without opposite substance we use it for this method, slow gradual method. Or we have a tawiz mukhalif. Say for example, when we go for alcohol de-addiction, we use warfarin. And warfarin, if once we take it, we cannot take alcohol, because if we take alcohol after warfarin use, it has serious side effects and patient may not be able to live. Then we have how opium de-addiction as model for de-addiction. Here what we say, tadrij or gradual reduction, how we do it. Gradual reduction is a long-term treatment. We already told about it. It may be from 6 months to 1 year. Suppose initially opium has been taken in early morning of some day. It has to be taken after sunrise. We just advise him that leave it in the early morning. You take it from 9 p.m. or 9 a.m. or 10 a.m. Just increase 1 hour. But within 1 month, this abstinence period may reach to 1 hour. We can change this timing. We can make it 1 hour. In second month, it may go for 2 hours. and third month it may go for 3 hours. Similarly, after 6 months it may go to 6 hours. That means he was taking it in the morning every day. Now he has increased it to 30 hours, the second dose. In this continuation, the difference will get to 12 hours within 6 months. Withdrawal will be easy when the abstinence period between the doses will reach up to 24 hours. If we are able to that a person is not taking the drug for 24 hours, we say that now withdrawal will be easy. It will be easier that a person can be de-addicted. Now, what will be the methods for this, for opium de-addiction, for this withdrawal? We go for that. We use an equal weight of chop tar or chop chini, Smilex China, Maida Lakdi, Listia chinensis is better in this method due to excess of rutubat. Since it is similar in rutubat, addition of rutubat in the body, so it is substitute tamun nisbat. So what we do, we use this chop chini in equal amounts, then keep on increasing the chop chini and decreasing this substance of abuse, opium, and at some time we will escape from this opium use. Khashkhash, papaver estimated to initial doses of opium and daily reducing one piece of khashkhash. Because we have now left this opium, we are using khashkhash, it will be of lesser quantity, and then again we are taking one piece from every day. If any physical disturbance appears by subsequent reduction, if there is some withdrawal, we stick our routine. We just stop at that time, keep on giving him the previous dose for some time, and then go again for the reduction. Then leave on previous condition for a long period to make physical adaptation. After that, try again reduction up to the stage which is not harmful. So these methods of taviz, substitution, how we do, if we want for taviz a munasib appropriate substitution, opium withdrawal is possible by this method. Decoction of khashkhash seeds, Papaver somniferum, is to be taken after admixture with opium. Here what we do, we take poppy seeds or khashkhash seeds, which are of the same this mizaj, but they have lesser addictive value. Here progressively keep on reducing the opium and increase the khashkhash quantity till the person takes only decoction without opium. Then we have a tawiz munasib can be differentiated according to the nature of the substitute. The same thing, tawiz munasib, it may have three types. Munasib shadidu nisbat, substitution by khashkhash or by decoction is extremely suitable. Munasib bayidun nisab, deviously suitable affinity of opium and the substitute, such as substitution by bazarul banj or shokran or lufa or sammare mukhrid bar, cold sedative fruits. For example, Jose Masil, but it can lead to Borudat and Yabusat. Then we have another thing that is we call tawiz a gair munasib, non-appropriate substitution. Here substitution will be opposite in quality to that of opium, such as substitution of BK chini or chob chini or alcohol khamre bar takdir are called haratab, har and wet, because they are opposite in the quality, and it is of opposite quality. Either nearby opposite substitution, such as substitution by alcohol, which is beneficial in hararat and is not harmful in causing yabusat. Either substitution without opposite substance, tawiz bagair zid, may be by single drug such as kinab, in which har condition is not found, or substitution by jinde bedastar. Kuchla, Trichonos naxamica, or by dar chikna, mercury chloride. Poppy plant, poste khashkhash, is used by two methods. One is decoction or powder form. Another method is removal of its potency by water. Substitution may be by compound formulations such as murakkab katrani, murakkab sabzi, or habbe kuchla. Then we have substitution by compound formulations. We have three very important formulations which we can take help of, like Nuske Khamre Gaya. It contains Bengal gram, and here what we do, the method of opium withdrawal by this compound is decreasing the morning dose of opium in small quantity of Bengal gram weight and adding 2 grams of this compound, Nuske Khamre Gaya. Progressively increase the second dose duration, then decrease the opium dose gradually and increase the dose of that compound. And at the end, the dose of opium should be withdrawn, and the dose of the compound should not be more than 7 grams. We have to reduce this opium, but we have to make the maximum weight up to 7 grams only for Nuske Khamri Gaya. Again, we can use Habe Kuchla. Here we have to we have to take the dose up to only 5 grams. Some features of this compound have been described as substitution features for opium. Its important parts are oud, mastagi, zafran, bish, and jadwar. In this Habe Kushla, we can use it easily for as a substitute. And then we have very important combination compound formulation Tiryake Farok. We can use it as a substitute, and that is also Bagair Nisbat. Then we have about abstinence syndromes. If there are abstinence syndromes, what we do? Say, for example, if a patient complains that after removing the substance of abuse, he gets respiratory and cardiac depression and heaviness of chest, or caused by running fluids of body, the whole of the body, and cause anxiety, or there may be brain weakness, sneezing, and facial paralysis caused by Harlaza matters. Running of fluids stops due to opium addiction, and at the time of withdrawal, these fluids come in running condition. It also leads to confusion, anxiety, and insomnia due to protraction of root. Secondly, the mizaj of person becomes saudavi, which causes yabusat and leads to insomnia. Insomnia is also caused by physical disturbance and restlessness. So these all are what we say abstinence syndrome. How we manage them? We manage it by strengthening of heart by mufariyat and dawaul misk. For sneezing, we go for soot or rogne banafsha badam, and for smelling of opium and use of covering of opi water is also effective. We can go for zimada poste khashkash on the forehead, which is effective for running of the nose and eyes, or we go for tufte yazdi or shokran, is also better for both, and also in weakness of heart and respiratory conditions. Again, we may have generalized body aches, which can be cured by Bazarul Bunch 125 milligrams, and with this massage of Surinjan, Jozba, or Magis and Jadwar in Rogne Babuna or Rogne Gule Sorok with Arke Gulab, we may also apply it. It will help us in removing these body aches. Why we do these things? It is because whenever we go for the detoxification process, there is definitely these withdrawal signs come up. And for these withdrawal signs, we have to check these signs by treating him with these drugs. Otherwise, we say that proper it is not the de-addiction of the substance. It is basically removing the withdrawal signs so that it is very easy for him to get de-addicted. Now, there are also treatment for alcohol craving, which is one of the one important withdrawal signs for alcohol. We may have badam talc, which has been mentioned for its use in alcohol craving. It is from Kuliat. Unani literature has several drugs that have mentioned for reducing the craving for alcohol. Not only badam talc, there are so many drugs. We can enlist them if we go for the literature. Hangover also, which is usually after alcohol intake, has also been dealt with in the literature, and for its management, lemon and other drugs have been indicated. All these drugs, they are mentioned in Unani medicine. But basically, how we go for de-addiction of alcohol, it is very important. For de-addiction of alcohol, we say that alcohol is beneficial also and harmful also. But there are less benefits in alcohol and more harmful effects of alcohol. If we keep on taking it, it definitely leads to death. After many times after several years. So if we want to see the method of slow gradual reduction, say for example, if we go for this alcohol and we want to take it in lesser amounts, it may be one of the methods. But one thing is what we say, using this substitute or gar tawiz method we use. Then one instance we have that our Prophet sallallahu alaihi wasallam, he ordered the persons not to take alcohol, and everybody threw all their substance into the streets of Medina. It looked as if it was alcohol was raining from the sky. It was flowing like channels. So all those people, they got devoid from alcohol. But was it certain? It was not certain. First, they were talked of that they should not take alcohol when they want to go for prayers. First, it was like this: if you want to go for prayer, don't take alcohol. Prophet told them. Afterwards, after 2 years or 3 years, alcohol was totally banned. Then there was one more thing. They were first told that you should not go for gambling and alcoholism. Then they were told that you should not take alcohol while you are praying. 5 times a day we have to pray, and on those 5 times you should not have alcohol, and there should not be any type of smell from your mouth of alcohol. And then last, after 2 or 3 years, it was declared that now alcohol is haram. So I say that this alcohol, if we want to go out of it, it is also a slow gradual reduction method. Now Kaplan and Sadak, they have told it as it is a turkey method, cold turkey method, and they say that now it is absolute. Though it is not absolute, we have changed the form. It is not absolute, we have changed the form. This cold turkey method, it was given in our Unani medicine, and it has been compiled by Ahmaduddin Shirazi, who has written the book Risale-e-Afyun, and it has been translated now into Urdu by Professor Abdul Bari. It has given us a complete this program for how we go for the de-addiction, this Risale-e-Afyun. So what I want to say that there is a full program how we can de-addict, but it is only our will which has not yet come up that we can develop a de-addiction center of Unani medicine. Everything we have the drugs, we have the plan for withdrawal symptoms, and we may have the infrastructure. We need not have very much infrastructure. Only one thing is left now, that is the will to go for this de-addiction center. Now there are certain areas where we have studied it and they have been documented. Jadwar was studied for attenuation of the withdrawal syndrome in the rat model and was found effective in inhibition of 6 signs after naloxone challenge. This study was carried out in 1998. Habe Shifa was studied for its attenuation of withdrawal syndrome in morphine-dependent Vista rats, and there was significant inhibition of the 10-point score in 10 withdrawal signs. This study was carried out in NIM Bangalore, I think before 8 years. And we have one more study. Asarun was evaluated against tobacco-addicted rats and de-addicted the rats in 28 days. It was also done in NIM Bangalore only. And one more drug, Habe Jadwar, it has been studied for effective cessation of smoking. And this study was carried by CCRM, and it is in the stage of completion, and I think they have gone for publication of it. So this literature we have, but not only this literature, in our Unani medicine, in our Unani books, we have ample plans.
Disturbed during night and bisyllabic words. Evaluation of symptoms: mental generals, fear of noise, startles easily. Physical generals, heart patient. Characteristic particulars: sleep disturbed during night, babbling, difficulty to articulate, bisyllabic word, difficult to extend right lower limb, stiffness on right side of the body. Now mental generals: fear of noise, startles easily. Physical generals, heart patient. Then characteristic particulars are sleep disturbed during night, babbling, difficulty to articulate, bisyllabic word, difficulty to extend lower limb, and stiffness on right side of the body. Now we have done the repertization, and we have given after repertization opium 1 1 dose, breathing potency, followed by PL. Now here, see the follow-up, pupil movement started, then blinking eyes started, lacrimation started, lower limb movement kinking, improving, stiffness on right side of the body, reduced sleep improving, making attempt to speak improving, then abscess ulcer on hard palate, old symptoms recurred, starting reduce. Then we are given now on 14/5/2024, trying to roll over, making attempts to kneel down, flexing and extending her right lower limb, stiffness on right side of the body, reduce, sleep improving, making attempts to repeat words improving, then starting reduce. Again we are given OPM. See here 19/4/2024, roll over, sleep on abdomen, making attempts to kneel down, flexing and extending her right lower limb, stiffness on right sided, reduce and improving sleep now, 12 a.m. to 5 a.m., speech towards recognizing family members' voice and starting 90% reduce. Now here on 11/6/2024, neck holding 90% attended, trying to sit with support, flexing and extending her right lower limb, then stiffness on right side of the body 50% reduce, sleep attempting to sleep, without medications. Now we stop the medications and we given reducing dose. Now repeat words starting occasionally. Then 2/7/2024, neck holding attend, completely trying to sit with support, flexing and extending, stiffness on right side of the body 50%. Then sleep 12 a.m. to 5 a.m. Repeat words starting reduce completely. Now here 38/2024, trying to sit with support, flexing and extending lower limb, stiffness on right side is reduced by 70%. Sleep 12 a.m. to 5 a.m. Repeat words. Now here, trying to sit with supports, flexing and extending, then stiffness 70%, tries to utter new words, tata, mama, papa, kaka, eye movement spontaneous for sound. Now here, 5/11, last time they came, trying to sit with support, flexing and extending lower limb, totally got cleared off, stiffness 80% reduced, sleep reduced, tries to reply to questions when asked whom you like, replied Appa. Now she is able to understand what others are speaking. Now see, this is the March 2020. This is the see May 20 again. Right hand, right leg. Responding follow up. Any questions? Now we'll move to second case, that is neurocystosarcosis. Second case, neurosis. See here also preliminary data. This patient name is Miss A, and she is having, that is Akshata. Her name, we are not revealing the name. Age 10 years, sex female, religion and national Hindu, residency Nagarbhavi, Bangalore. Informant self and mother, and OPD number is 45640, and case taking is 38/2000. See the chief complaint. Patient presented with the complaint of recurrent episodes of blank staring, spells or upward rolling of eyes, and jerking of left hand since 4 years of age. History of chief complaint. The patient presented the complaints of recurrent episodes of blank staring, spells and jerking of left hand since the age of 4 years. In 2015, the patient had the first episode of upward rolling of eyes that lasts for few minutes. She was taken to a nearby hospital. She was fully conscious but had slight altered sensorium. Following the episodes, her GSCS score, Glasgow Coma score, was 7/15, and she was in PICU for 10 days, during which investigations were done and the necessary treatment was given. CT scan revealed diffuse cerebral edema, a lesions in the parietal lobe measuring about 10x10, 5 centimeter, and MRI report showed 2 ring enhancing lesions in bilateral parietal lobe. Other diagnoses were ruled out through other investigations, and she was diagnosed as a neurocysticercal encephalitis. Following the episode, she was on allopathic medications. She then had another episodes of seizure a few days later, during which she had upward rolling of eyes, altered sensorium, and involuntary urination. In 2016, she had another episode of seizure that had a blank staring spell, swinging movement of left hand that lasted for 1 to 2 minutes, followed by altered sensorium for a few hours. MRI showed left parietal lobe ring enhancing lesions with perilegional edema, colloidal vascular stage of neurocysticercosis. How many stages are there in neurocysticercosis? PG scholars, UG people? There are 4 stages are there, and this is the 4th stage where they'll be having the colloidal vascular stages of neurocysticercosis. A month later, she had another such episode, following which up to 2019 she had no such episodes of seizure. And in 2019, she had a similar episode, following which up till today, she has no episodes of seizure. She is under allopathic treatment for the same. And she is on this medication, Triptyl 60 mg, Levipil 10 mg, 10 ml OD. She also present with severe episodes of headache over the vertex, which is a pulling type of pain that lasts for 2 hours, aggravation by sun exposure, annihilation by sleep temporarily. Since the complaint, she has slight cognitive decline and struggle understanding the mathematical concept. Takes time to solve problems. There is no history of aura, weakness of limb, injury, loss of consciousness, biting of tongue, frothing of saliva, fever, triggers like light, exercise or sleep deprivation. Past history, past medical recurrent episodes of urinary tract infections at the age of 2 years. Then past treatment history, allopathic treatment, family history, nothing significant, not allergic to dust. Birth history, birth and developmental history, non-consanguineous marriage, G2, P2, A0, L2 and D0. Perinatal planned pregnancy, ANC was done. Regularly, all scans were normal. Natal NFT, home delivery, birth weight is 3.2 kg. Postnatal baby and mother were healthy and breastfeeding was done following birth. milestone attained on time, immunization done as per schedule, no adverse effect is there. Then personal history. Here diet vegetarian, appetite good, and thirst for 1 liter per day. Desire sweets, aversion nothing specific. Bowel habits regular, no associated complaint. Bladder habit regular, no associated complaint. Sleep 10 p.m. to 6 a.m. good. Refresh upon waking, and dream nothing specific. Unremembered. Perspiration scanty, thermally chilly. See, on general physical examination, everything came to normal. Weight, height, BMI, scalp healthy, eyes conjunctiva pink, ears no impacted ears wax, and DNS obstruction, nothing is there, everything is normal. No signs of pallor, cyanosis, clubbing, lymphadenopathy or edema. Vital signs, temperature febrile at the time of examination, pulse is 86 beats per minute, and regular rhythm, moderate volume, vessel wall not palpable. Respiratory rate is 16 breaths per cycle per minute. And systemic examination, respiratory system normal, cardiovascular is normal, then abdomen, everything is normal. See, nervous system examination, stance and gait normal, higher mental functions are conscious, alert, cooperative, well oriented with time, place and person, memory immediate, recent and remote memory intact, attention and concentration intact, speech spontaneous speech present, no repetitions, appearance, self-care and hygiene maintained, behavior restlessness kept moving about, then handedness is right-handed people. Usually right-handed people, they left hand, left side. Nervous system examination, cranial examination, no loss of sense or of smell, visual acuity, normal visual field, normal color vision, normal eye movements in all directions, people reflex, sensory and motor components are intact, no facial asymmetry, muscle power normal, hearing intact, and no deviation of uvula, gag reflex not performed, normal power of trapezius and sternocleidomastoid muscles, no deviation of atrophy and fasciculation. Nervous system examinations, again motor examinations, inspection, no fasciculation, normal muscle bulk and bilaterally symmetrical, no atrophy noted, tone, no hypertonia noted in the lower limbs, no abnormal postures, power, no reductions of power in the limbs, reflex, superficial and deep tendon reflex are intact. Now, nervous system examinations, coordination is normal, sensory, everything is normal, cerebral function test also normal, nystagmus, dysdiadokinesia, and intention tremors, everything is normal. Now, see the brain report, what they are seeing. Resolved ischemia, see, they are showing about neurocysticercosis. Here they got resolved with CT scan brain after giving them remedy. See here. First report show this. Now see after that. Final diagnosis is neurocysticercosis. The classification of disease is true natural chronic disease, fully developed symptom, miasmatic disease, complex miasm. Now common and uncommon symptoms. See, synthesis or repertory, we have done the repertorization, comprehension difficult, head pain, link vertex, head pain, touch aggravation, head pain, sun exposure to sun form, stomach thirstless, extremities jerking, hand, and generals convulsions, worms form. After see the mental general, physical general, and characteristic particular, we came to see these are the totality of symptoms, mental generals, physical generals, characteristic particulars. After that, we done the repertorization, and we are given the remedy Sinna 1 1 dose. And with this, no recent episodes of seizures, complaints of headache frequency gets an episode 2 to 3 times a week, but intensity remains the same. No new complaints. Generals are good. Then 17/12/2022, no recent episodes. Complaints of headache has reduced in frequency, gets an episode 2 to 3 weeks, and intensity has slightly reduced, no new complaints. 26/2/2023, the patient had an episode of seizure 21-23 with eye to the right and jerking of both the hands lasted for 3 to 4 minutes, followed by stiffness and altered sensorium. Following the episode, she had severe pain in the vertex, aggravation by slightest touch. She was taken to a nearby hospital and further investigation were done. See the investigation and the reports are. See the report. Conclusion. They written bilateral paroxysmal and their rings are now disappear. Following the recent episodes of seizure, the case was reanalyzed and cuprum metallicum was selected for the following reasons. Almost all convulsive tendencies are cured by it. Single part convulsions, tonic convulsions of hand, convulsions from worm complaints, pain in vertex associated with convulsions. Cuprum med 0/1 was given. Now, no recent episodes of seizure. Complaints of headache has reduced in frequency, gets an episode once a week, and the severity of pain has reduced. No new complaints. Then 16/6/2023, no recent. All the complaints are better. Now, she won't have other, not till now she is following. The headache is not there. Only she'll come and she'll visit. Because I told it can be may occur. You can come and visit every month or once in a 2 months. She is now following the same. Any questions? We'll move to the third this one. Time is there or enough? Time is there. If permit, I'll take for cerebral palsy. Otherwise, time is enough. Okay, thank you. Any questions?
Any questions? Thank you, sir, for your comprehensive talk. Your insights into homeopathy's approach to neurological disorders have beautifully complemented today's interdisciplinary discussion. Now, I would like to invite Professor Hamiuddin, sir, HOD Department of Sadla, to please present memento to Dr. Mudassir, sir. Thank you, sir, for doing the honors. Now, I would like to invite Dr. Sophie, sir, for concluding remarks. Please, sir, take on the stage. As we come to the conclusion of this remarkable conference, it is time to express our gratitude and honor the key contributors who made this event a great success. The valedictory session is not just a closing ceremony, it is a moment to celebrate the knowledge shared, the bond strengthened, and the collective vision that we have created through interdisciplinary approach to neurological disorders. Now, for the valedictory session, I would like to invite Professor Sophie sir, Professor Arshia Sultana ma'am, and Dr. Kausar Firdos ma'am to facilitate the facilities. I would like to request Sophie sir to take on the stage for concluding remarks.
Assalamu alaikum. And good evening to all. Basically, this concluding the day's work in few sentences, it is very much tough. But I will try to summarize it, taking all the lectures in perspective. We started with Unani presentation, which was very elaborate and discussed about diagnosis and Unani perspective of neurology, this pathogenesis and diagnosis of Amraze, Dimagh, A'sab in Unani medicine. It was delivered by Dr. Muzaffar Ahmad Bhatt. He told us a comprehensive way to how to bridge gap between Unani and conventional medicine and how we can go forward in management of these diseases. Then we had, after tea break, we had another lecture by approach to neurological examination, which was very thorough, and we had checklists so that we could easily differentiate diseases, and then we could diagnose also. And it was from this conventional medicine. And then we had a bit a focused group where we have certain neurological diseases. It was given by Dr. Arshia Sultana. She told about brain and body navigating neurological disorders during pregnancy. And after lunch, we had a great session by three pathies. Professor Abdul Qadir Saab, he deliberated about the Ayurvedic treatment and management, especially Panchkarma, for neurological disorders, and he gave us a review, and we were much enlightened that there are some similar regimens, procedures, and he tried to exemplify Ayurvedic procedures through Unani terminologies like various Alaj Tadbir procedures. And then his way of talking, his way of lecturing, or his way of presentation, it was so nice that we all were enthralled even after having a great lunch. Then we had that homeopathic perspective by Dr. Mudassir Mullah sir. He gave us the heart of homeopathy. He put it before us, how to make the use of repertory and how to see the major and minor signs in a particular disease, and then see how to correlate the drugs according to the signs by using repertory, and then giving us the practical case reports where rare cases which were not manageable in conventional medicine, he showed us, he presented us those cases, and those cases, only two, unfortunately we could not see the treatment through of this cerebral palsy, but the two cases which we saw, it exemplifies the versatility of homeopathy in neurological diseases. Then we had one more lecture about this de-addiction, and I hope you people liked it. And there is a need that we should have a de-addiction center somewhere in Unani medicine, be it NIM Bangalore or anywhere else, because we have the things, we have the means, and it is not, the days are not far that we will have one de-addiction center at some place. So this was the overview, but last but not least, it is that sticking to our framework, our theories, our concepts, there is enough scope that we integrate within the systems, within the traditional systems, and then we have the methodological framework which is very much evidence based from conventional medicine. We can bring it up and we can verify, validate all our assertions, our claims because of the conventional standardized methodology, and we can incorporate our own holistic methods in it so that we can show the world that there is knowledge beyond conventional medicine which is observational and which can surely be evidence based. Thank you very much. I hope this seminar has given you a message, and you will, and we all will strive for this message and look towards the future with a brighter side. Thank you.
Thank you, sir, for your concluding remarks. Now, I would like to invite Dr. Sophie, sir, to present memento to Dr. Professor Arshia Sultana, ma'am. Now, I would like to thank you, ma'am, for doing the honors. Now, I'd like to Dr. Sophie, sir, to present memento to Dr. Arshia Sultana, ma'am. Next, I request Dr. Gulamuddin Sophie, sir, to present memento to Councillor Fatima, ma'am. Thank you, Kausar ma'am, for your valuable contribution and support to this conference. Now, I would request Dr. Sophie, sir, to present next memento to Dr. Sadiq Ali, sir. Sadiq sir was a coordinator of this program. Thank you, sir, for your dedication and engagement in making this conference a success. Next, I invite Dr. Wasim Ahmed, sir, to receive memento from Dr. Sophie, sir. Sir was also a coordinator of this program. Thank you, Wasim, sir, for being a continuous support in this conference. Moving on, I request Dr. Sophie, sir, to present next momentum to Dr. Khaliqur Rahman, sir, our next coordinator of this program. Finally, I request Dr. Sophie, sir, to present memento to Dr. Abdul Aziz, sir, coordinator of this program. Now, I would like to invite Saeed Mohammad Rafi, system admin of this auditorium, for taking the certificate and participation in this program. Next, I would like to invite Salim Mohammed Beg, technical staff in charge, for being an important part of this conference. Ladies and gentlemen, with this we conclude the momentum presentation of this ceremony. Now I would like to invite Dr. Kausar Fatima ma'am to deliver a vote of thanks.
Assalamu alaikum. Very good evening. Happy for the day. Why? For gaining knowledge of the distinguished faculties of Ayush and also of the modern. We are also happy as organizers for the successful completion of today's event. Of course, I am here to propose today's vote of thanks. I take this privilege to present a vote of thanks to the National Conference on Interdisciplinary Approach to Amraze, Dimagh, A'sab. That is the central nervous disorders of the central nervous system. At the outset, I thank Almighty for making us capable to conduct such educational events. At the outset, I thank our chief guest, Dr. Asima Banu, Principal, Bangalore Medical College and Research Institute, for gracing the inaugural session despite her busy schedule. I thank Professor S. Manjula Ma'am, Principal, Government Unani Medical College, for her presence and collaboration for today's event. I further extend my thanks to Director in Charge, Professor Hunamuddin Sufi sir, for his leadership and guidance to conduct the program smoothly. Our special thanks to Professor Abdul Nasir Ansari sir, who took the initiative for such interdisciplinary conference on the diseases of central nervous system. I'm happy to announce that this is the second interdisciplinary conference under sir's guidance. Around July this year, we had interdisciplinary conference or similar sense on cardiovascular system. I thank all the speakers of today's conference, Dr. Muzaffaruddin Ahmed Bhatt sir, Dr. Bhimarai David Mani sir, Dr. Arshia Sultana ma'am, Dr. Abdul Khadir sir, Dr. Sufi sir, and Dr. Mudassir Mullah sir, who has joined us to share their experience and expertise with all of us. I further extend my thanks to all the HODs, faculties, PG and PhD scholars of our institute and from different colleges across India, particularly from Karnataka. I thank all the delegates once again for making this program a grand success. I thank our organizing committee members, organizing patron, Professor Abdul Nasir Ansari sir, organizing chairperson, Dr. Aisha Sultana ma'am, and coordinators, Sadiq Ali sir, Dr. Khaliqur Rahman sir, Dr. Abdul Aziz sir, and Dr. Wasim Ahmed sir for their untiring commitment and hard work to make this conference a grand success. I also thank all the PG scholars backstage and at the registration counter for their coordination. I thank system admin, Mr. Rafi, and our engineer JE and other staff, Mr. Salim and Mr. Musab and other supporting staff, Mr. Mutahir, Ranganathan and Hanmanta for their coordination and support. Lastly, I thank everyone, those directly or indirectly involved, to make this conference a grand success. Hope to see you all soon at maybe different venues with different heads and different conferences. And let us carry on this legacy of learning. Thank you once again.
Thank you everyone for making this conference a success. This is high tea
A moment,
time.
Sorry. Somewhere or the other, we miss some people. I'm very thankful for the host of today, Dr. Renuka ma'am, and Dr. Ishrat Rasool, PG scholar from pathology.
Thank you, ma'am. Thank you everyone for being here and making this event success. It's a high tea time. Thank you so much.